Hi, I'm Natalie, and I'm going to be presenting today on systemic lupus erythematosus. The reason I chose lupus as my disease to research for my signature assignment is because my mom actually has lupus, and I wanted to be able to find out more about her condition and her health. Systemic lupus erythematosus is the most common form of lupus. There are many different kinds of lupus. One of them is a nephrotic lupus, and that's affecting mostly and only the kidneys. And there's cutaneous lupus, where lupus only manifests itself on the skin. With systemic lupus erythematosus, it's completely everywhere in your body. It's not focused in one area. And it's the most common form, unfortunately. In the United States, it's known that 1.5 million people live daily with lupus, and of that 1.5 million people, 15% are children. So, lupus is described as an autoimmune disease, and what that means is that the immune system doesn't recognize itself and it starts to attack itself as a foreign intruder into the body. That's where a lot of the symptoms come from, is the body attacking itself. So, common symptoms you'd be experiencing every day with lupus are extreme fatigue, specific skin rashes, fevers, and pain and swelling in the joints. This means that the most common body systems affected are the integumentary system, the nervous system, respiratory system, and urinary system. The Lupus Foundation is one of the bigger organizations that provides funding for research, and they describe lupus as an unpredictable and misunderstood autoimmune disease. It is difficult to diagnose, hard to live with, and a challenge to treat. So over here in this diagram, this is also by the Lupus Foundation. It's estimating medical bills on average per year to be around $21,000. I checked with my mom, and she said that this number is pretty accurate regarding medical care. And the statistic right here is showing that 1 in 4 people who have lupus are left permanently disabled. And unfortunately, this is a very high percent. 25% of people end up permanently disabled. So the demographics, this is actually very interesting and makes lupus stand out among other autoimmune diseases, is that 90% of lupus cases are women. That is a huge difference. And although men can get lupus, they're just most likely not going to get it. Lupus doesn't follow a pattern. There's not any specific group of people that are affected more than another. The only commonality seen is that women childbearing age, 15 to 44-ish, are the ones who are most affected. And as far as genetics go, lupus is not considered to be genetic. If you have an immediate family member, like your parents or siblings, that have lupus, you would only be a few percent, 2 to 5% more likely to have lupus than someone who doesn't have a family member with lupus. So moving on to symptoms, lupus is hard to diagnose because a lot of the symptoms go with other diseases or are just other diseases in general. So I've mentioned the extreme fatigue. This will put someone who maybe is otherwise healthy besides lupus. They will not be able to do normal tasks because it just caused such great exhaustion. For example, my mom just gets so fatigued and in so much pain after she goes grocery shopping. That's really too much for her, so she tries not to go unless she has to. For other people, this can be social events, work, even just moving from room to room. It depends on if there's a lupus flare and the severity of the lupus that individuals have. Some of the other symptoms, painful and swollen joints, that goes with fatigue. These headaches are persistent. Not just an every once in a while headache, they're pretty often happening, as well as the fevers. Something that I personally find very interesting is the sensitivity to the sunlight, UV light. and also not on here is fluorescent lighting. For some reason, people with lupus have an extreme sensitivity to light. And I've seen this in my mom. She really can't be in the sun for more than 5 to 10 minutes. I know it sounds really ridiculous, but it will put her in a flare. Under very harsh fluorescent lighting, same thing. It's just not something that people with lupus can handle, unfortunately. So the rash, this is a diagram of the rash. It can be anywhere from an orangey color to pink to dark red, even to purple. And it's in this shape that looks like a butterfly across the cheekbones and nose. This rash doesn't really come and go. It sticks around. It's pretty persistent. It's hard to get rid of or lighten, and it's completely symmetrical. So my mom experiences this rash across her cheeks and nose. Some people have it on their temples and chin, and some people have it almost covering their complete whole face. But this butterfly or malar rash is one of the diagnostic things with lupus. Hair loss. I've noticed this in my mom and in other people I know with lupus. Their hair comes out in chunks. They'll get balding patches, and sometimes these patches will also get really like bumpy skin, kind of like a psoriasis look to it. It's very painful to have their scalp touched when they're flaring and their hair is falling out. And another very interesting symptom of lupus is actually another disease called Raynaud's. Here you see an example. The tips of the fingers are not receiving blood. They go ice cold, and it's hard to warm them up. They kind of hurt when they're cold like this. It also can happen in the feet, in the toes. It's very uncomfortable. Next, here I have a diagram that is showing some symptoms grouped by area. Some of the more serious signs and symptoms are the blood in the urine, that's indicating kidney dysfunction. Lupus medications are very harsh and very strong, so this can come from medication use as well as just inflammation from the body. Another very serious symptom is any kind of chest pain. Atherosclerosis is very common in lupus patients. As previously mentioned, lupus is difficult to treat and hard to diagnose, and the reason is because it can affect any and every body system. Every patient is different. I know some people with lupus who have absolutely no skin manifestations of lupus, and it's strictly kidneys and fatigue and pain. I know in other people it is just skin, and it is the hair and scalp issues as well as cutaneous rashes all over the body that look like psoriasis. Here I have some comorbidities. What that means is it's diseases that are also, or conditions that are also related to lupus and are seen a lot. These include kidney disease, thyroid disease, heart disease, anemia, blood clots, joint pain, and the rashes, photosensitivity. All these things are related and seen in a lot of different lupus patients. So on this slide, I have some different symptoms and problems that are caused by lupus and why. So for example, a common symptom of lupus is digestive distress, and because of the inflammation, the body isn't focusing resources on digestion. So the body doesn't always remove waste quick enough, and that can start causing digestive issues. Other types of inflammation can also cause the lymph glands to swell. Your body's thinking it's fighting an infection, but it's really just fighting itself. Those glands swell and get very painful. Another sign of the inflammation is pancreatitis, which is also very painful, and this is usually caused by the medications used to treat lupus. So what causes lupus? We don't know. We do know what makes lupus worse and some things that might make you more prone to it. There is such a thing as medication-induced lupus if you're on a prescription, and sometimes you will develop lupus, but only in response to the medication that triggered it. Um, and then, so we also have some of the other things that make you more likely to have lupus: estrogen levels, other infections or diseases that you may have. Smoking will definitely make you more prone to lupus. And genetics, sometimes people are just more prone to chronic illness. Lupus might end up being on top of the existing chronic illness. So, for right now, researchers say that the cause of lupus is unknown, and because it's such a complicated disease that manifests itself and presents itself completely different from person to person, not any two lupus cases are the same. So, we are still trying to get more research done on the disease. That is, again, what the Lupus Foundation is aiming to do, is to get some answers to these questions, like what causes lupus. Next, we have treatment. So, as of right now, we don't know the cause, and there also is no cure. Lupus is a chronic disease that most people will experience once they have it for the rest of their lives. The only way to treat lupus is to do symptom management. So, this would be different medications for the joint pain and swelling. This would usually be a steroid of some kind, as well as a anti-inflammatory medication. Um, Diet is super important. So something that my mom's doctors have reiterated over and over is that it is important to eat an anti-inflammatory diet. What does this mean? Reducing sugar, reducing processed foods that are full of chemicals. Dairy can be considered inflammatory, and definitely no alcohol. These things all will irritate your body more and may trigger a flare. Some doctors will prescribe immunosuppressives because your immune system is so highly trying to function. The immunosuppressants will kind of bring you back to normal and reduce the amount of flares that you're having. A very interesting drug that is used is anti-malarial drugs. These drugs help reduce the inflammation, and they also help your body continue to try to heal itself from a flare. The most commonly prescribed anti-malarial drug for lupus patients is hydroxychloroquine, and it is used in pretty much somebody's treatment plan at some point to see if it does help, because in some patients, like my mom, the hydroxychloroquine drastically manages her symptoms. Unfortunately, some people's pain gets to a point where we need to start prescribing very high painkillers. This is your Norco and your Vicodin. Many patients end up having to be on one of these medications almost daily after having lupus and severe flares for a very long time. So the type of doctor that treats lupus patients is a rheumatologist, and the rheumatologist can prescribe different medications and treatments. Here we have some tablet drugs on here: the NSAIDs, the antimalarials, the steroids, immunosuppressants. Those would be taken as a pill. Some rheumatologists will also prescribe biologics, which are usually an IV infusion you would get once a month or once every 3 months, depending on the drug used. Another type of treatment that is just started being used recently is monoclonal antibodies. You may have heard of this in response to COVID-19. Giving the patients monoclonal antibodies sometimes reduces symptoms from being as severe and may get rid of some symptoms completely for some patients. Thank you for listening, and I hope I was able to inform you more on a disease that is still being researched and learned more about. Thank you.